when we think about the main causes of eustachian tube dysfunction in children compared to adults, in adults, I'm thinking chronic allergic rhinitis, chronic rhinosinusitis, reflux. In children, there's also the extra inflammatory exposure with the recurrent viral infections. I think of like the kiddos who go to daycare and are just kind of like sick and snotty all the time. Their anatomy kind of, maybe sets them up for more issues because the eustachian tube hasn't quite matured yet. What else do you think about in that age group?
Right. Well, surprisingly, from about age 6 above, it's the same etiologies that you just mentioned: allergic disease, reflux, rhinosinusitis, general snottiness if you need. But it's more robust in the kids. Their inflammatory reactions are greater. So when I see a 6-year-old and they're still having trouble with their ears, allergies are the most common. And there's been good work on that. David Hurst and others have seen a very high percentage of allergic disease in the kids who have not outgrown the need for tubes. So we do a lot of allergy testing. We do a lot of allergy management and thinking about reflux and those other pathologies. Under age 6, then you start getting into more of the infectious problems. And particularly age 4 and under, there may be reflux of pathogens as a cause. So this is where there's got to be a lot of research before we know that we can uniformly do balloon dilations in the future and those kinds of age ranges. Obviously, we wouldn't want to make refluxing of pathogens worse.
Yeah. When you're seeing these patients in your clinic, any particular questions in your kind of history gathering that is different from any other patient that you're seeing? Any particular questions that you're asking that are really important to that workup?
So are you asking just about the otitis media workup in general, or you mean specifically who I'm thinking about ballooning?
I think both. Yeah. So for your pediatric patients who are coming in and let's say they've had tubes before and we are starting to think about balloon, are there particular questions that you need to ask?
Well, one of the first questions, when they've already had a tube, I want to know how well did they do with that tube? Was it getting infected? Was it draining? Did it help? Was their speech getting better? And were there any problems with the tubes? Were they getting occluded? So if you've got a lot of adenoid tissue up against the eustachian tube, that's a good indication for adenoidectomy. And so ask about snoring, nasal obstruction, rhinitis. Definitely asking about allergies. Why didn't they outgrow this problem with one round of tubes? Asking about allergies, reflux, upper respiratory infections. I want to know, have they ever been patulous? It's incredibly common. Kids get patulous eustachian tubes far more commonly than we realize. And they're sniffing. It gets passed up as their allergies, but they're sniffing to cover it up frequently. And so, they just say they've got a blocked ear. So unless you ask about autophony, hearing their voice echoing in their ears, hearing their breathing, like Darth Vader's breathing in their ears, all the kids get that. You have to ask. And one of the things I've seen in these kids who've had multiple tympanostomy tubes, a tube will treat a patulous eustachian tube, in my experience, more effectively than it will treat an adult's patulous eustachian tubes. It'll relieve the symptoms. And so we can miss this. These two kids are getting multiple tubes. They fall out and their patulous symptoms come back. So they're sniffing, they're complaining about blocked ears. They can come into your office, they can have negative pressure because they're sniffing. They can even have an effusion because they're sniffing so strongly. And so we just automatically put another tube in, assuming it's obstructive dysfunction, without ever asking about autophony. And some of these patients will get sent to me for a balloon dilation. And I see this about once a week. It's very common. Patulous eustachian tube in kids is very common. It's not rare at all. We just have been missing it. And so you absolutely do not want to do a balloon dilation on one of those patients. In that case, if the tubes have worked great for them, fine, put another tube in until the TM starts to fall apart. Then you can do a cartilage tympanoplasty, reinforce it in the future, and that might help their patulous. So we have to be really careful to sort out the patulous patients from the obstructive dysfunction. That's probably the single most important. Chronic allergic rhinitis is the most frequent comorbidity that we see with patulous. So if you've got a kid who's allergic and they're needing more than one tube here, you've got to ask about autophagy. Has your ear popped and all of a sudden you're hearing that voice and breathing echoing in your ears? You will be amazed how common that is. So got to ask. sort those out, and then decide on treatment. You can do another tube,